The crux of this study is that for the first time we could demonstrate that for strokes that are caused by blockage of the basilar artery, which is a vessel in the back of the head that supplies critical structures in the brain, and whose blockage typically results in very devastating strokes or death, that for the first time we were able to demonstrate that endovascular therapy, so going from the inside of the vessels, improves outcomes. And that is aligned with previous studies in blockages of vessels in the front part of the brain, where we had already several years ago demonstrated significant benefit of opening up these vessels in stroke. In this issue of the New England Journal of Medicine, our trial and another trial also conducted in China had pretty much identical results, showing very substantial benefit to the same extent that was shown in the front part of the brain with opening up blockages of the basilar artery. Once the blockage in the back of the brain of the basilar artery is diagnosed, right, there's several options. One is to just use aspirin, right, or blood thinners like heparin. That is in patients who are beyond 4.5 hours after symptoms onset, because within 4.5 hours the standard of care is to administer clot-busting drugs such as TPA or TNK more recently. But now we have evidence that in patients with these kind of blockages, that these treatments are not enough, that there is benefit beyond these treatments to include endovascular therapy for stroke, and very importantly, up to 24 hours. Primarily, this was a trial designed to address the benefit of thrombectomy in patients who do not qualify for TPA because most of them present outside of the time window. And I think this study has conclusively shown that, yes, there is very strong benefit in these patients. This is a very similar procedure to the procedure that they perform in heart attacks when a vessel in the heart blocks off. It's very similar in concept and in execution, if you want. Typically, so traditionally, we've been going through the groin vessels. From inside of the vessels, we go with catheters, tubes, over wires. We go right where this blockage is, all the way from the groin up to the back of the head, from the inside of the vessels. More recently, we just like in cardiology, just like in heart attacks, we're using more and more the wrist as the access site, the vessels from the wrist. So either one, we access, we get to the blockage, and then depending on the cause of the blockage, if the blockage is caused by a clot that comes from somewhere, say from the heart, we typically just remove it. It's called thrombectomy, either by sucking it out with a tube. It's just simply sucking out the clot with a tube attached to a syringe or a pump. Or we have devices called retrievable stents or stent retrievers, where we put a stent across the blockage, and that stent sort of engages the clot. The clot becomes enmeshed within the stent, and then we pull back the stent, and we capture the clot. However, similar to heart attacks, where most of the blockages are caused by a hard plaque underneath the 100% blockage, so there's plaque plus some clot on top of it. That's something that is more common in this type of stroke. So sometimes sucking out the clot or removing the clot is not enough, because underneath, after you've removed the clot, there is also a severe blockage that remains, and that has to be addressed. And then sometimes we have to put a stent there, just like in patients with a heart attack. Fortunately, with the advancement in technology that we've seen in the last years, the procedure is becoming more and more simple and short. That is a critical component of this procedure, because the faster blood flow is restored to the brain, right? That's the primary goal of this procedure, to unblock the blocked vessel and thus restore blood to the brain. So the faster that happens, the higher the chance of a good outcome. So we've seen tremendous advancements in this type of technology in the last years. China has a very high incidence of stroke, especially stroke in the back of the brain, basilar occlusion. We thought that China would be a very good venue for this kind of trial. Lots of patients, good procedural skills. And we set out on this project. It did take some time. The pandemic obviously was a big barrier to overcome, but at the end we were able to enroll the number of patients sufficient to show a benefit.